Do we live in a police state? Well, America has seen better times, and I think the whole world has too. But a police state? Or, as a few have said also, what about a toxic state? Or a totalitarian regime? Well, it seems to me that labels and terminology mean an awful lot. And why not call our country and large parts of the world a Thorazine-State? For Thorazine came on the scene in 1951, the first ever major tranquilizer. It was billed as a miracle drug and emptied out many a, quote, mental hospital. If I didn't mention 1951. But what were the long-term benefits and downsides? I refer then to our country in particular perhaps as the Thorazine-State, because Thorazine really isn't in vogue today. Side effects are quite high. But the drug was tweaked, refined if you will, for side effects. And now there is the second generation of these. It was billed first of all as a major tranquilizer and then relabeled as an antipsychotic, and yet again often now as a mood stabilizer, and even more recently termed an adjunct or add-on for depression. And so what is the effect then of this drug? And can we call other drugs somewhat by the same term, a tranquilizer? For from the Buddhist circles, for instance, there comes a man, Thich Nhat Hanh, a leader of a monastery for some time in France until failing health a few years ago. And in one of his books on fear, which I was looking at 3-4 years ago, he mentioned that Americans have a penchant to go to the store and get tranquilizers. And what is the definition of a tranquilizer then, you might ask? Isn't it to calm, to tranquilize, to soothe? And aren't relationships in a way tranquilizing to the extent someone soothes us when we're troubled or having frustrations? Even food is sometimes called comfort food. A minister several years ago said to the congregation, and I part of it, why don't you eat a little comfort food from time to time? His having a few extra pounds around the center, that was his, quote, drug of choice, as I've heard a practitioner refer to food even. And we know, too, after a Thanksgiving dinner, and we might have a big meal and feel quite calm and tranquilized, if you will. So the definition then of tranquilizer, I think, doesn't even have to refer to the major tranquilizer, Thorazine, but it can refer to food. And many a person struggling in life goes to the bed, so to speak, just like some are said to go to the bottle, alcohol and all, to escape from fears, call them worries if you want, or troubling anger also. And so food can be a tranquilizer. Whether we're going to talk of it in terms of major, minor, I think is a minor deal. Again, sleep also a tranquilizer, if you will. Now, Michael Jackson, the famed singer, in fact, in the last days of his life, probably the last months, used an anesthesia drug. Anesthesia drug, I believe, used on the operating room areas. He had a physician who administered this or prescribed it, and Michael Jackson carried around with him a little suitcase at all times with an IV for intravenous administration of this, call it tranquilizer. And so I think many of things in our lives are tranquilizers. Even people, friendships can be tranquilizers. Even sexuality has an aspect involved. It being said that to calm down, we can go to this also. So, just as the phrase once was in the 1960s perhaps, love makes the world go round, why not consider now that Thorazine, and not getting nitpicky then, all the adjuncts, all the improvements, it is said, in terms of potency and side effects, well, why not call all of this tranquilizing? Even note then that when the drug lithium, which was declared a miracle drug for what they termed bipolar disorder, first called manic disorder, well, this was discovered by the man Mr. Cade to have a very, quote, tranquilizing effect on guinea pigs when first tested on them. The word specifically tranquilizer was used. And so you have to just take a step back, perhaps, I would think, and enlarge our definition first of what a tranquilizer is as per soothing, and how these things operate. You might say even sleeping, not just retreating to the bed when troubled for some, especially if they would call it in terms of depressive aspects, or some say being bummed out. All of that, arguably, sleep a tranquilizer, unless, of course, you have a good dream or a bad dream, called a nightmare, perhaps. Death even might be the final tranquilizer, and you will be tranquilized, perhaps, until either an afterlife kicks in or permanently. The Buddhists saying perhaps there being a reincarnation event, and then the tranquilizing effect, I think, would wear off, of course. And so, while hospital beds in the psychiatric area were emptied out largely in the 1950s with, quote, Thorazine, you have to wonder then whether other beds started to fill up, particularly in nursing homes as they're called now, Alzheimer's homes, and even prisons. For isn't it interesting that socialized medicine came into being in America, I believe in the early 50s, right on the adjunct then of when Thorazine was, quote, discovered by accident as to its powerful numbing effects, if you will. For isn't a Thorazine drug, any tranquilizer, a numbing drug when it comes to the matter of anger, fear, or what you might alternately call catastrophizing, these two things in particular. And so the whole concept then of a tranquilizer, I think all too often gets buried, or shall we say, the forest for the trees is missed, because the trees tend to be all the improved drugs, it is said, such that many of them aren't even called tranquilizers or antipsychotics. Now, Xanax, for instance, Klonopin, those are definitely called minor tranquilizers, but many of the other drugs are not. For instance, antidepressants are not just used for people who are struggling and called depressed. They are also used for people with problems with hope. Now, I've never heard it called a hope disorder, but people calling in on a suicide line are said to be missing mostly hope. And they are administered a hope drug called an antidepressant typically, if not electroconvulsive therapy alternatively or in addition. Call that, if you will, then a tranquilizers too. So, interestingly then, an antidepressant can also be used for matters of what they call PTSD, post-traumatic stress disorder. And that is considered an anxiety disorder or problem. Call it a fear problem, if you will. And the drug then arguably dulls the mind such that the fear is dulled also. But what else is dulled, perhaps, many people say, is sexuality. Sexuality tends to grind to a halt or become much less of an interest for many people using an antidepressant or what you might call an improved version of Thorazine as per a tranquilizer. I've never heard an antidepressant pill, as dubbed, termed a tranquilizer, and yet it is used often for PTSD, which is anxiety of a sort. And some complain then of the after effects or impact upon their sexual functioning and drive, their libido, so to speak. Interesting side effect profile, if you will. So once again, with the advent then of nursing homes paid for the first time ever in this country around 1950 era, does that have any tie-in then to utilizing a variety of drugs, first Thorazine and then other drugs to follow, including, quote, antidepressant tranquilizers, I would call them. For many, a person in a, quote, nursing home might not be a happy camper unless administered a tranquilizer of some type, either for their own benefit or any visitors who might come and not see them so smiling anymore, and not so happy just with bingo and interruptions at 2 a.m. to check blood pressure, and people coughing in the bed next to you, for instance. Now, if those things are not part of the picture of a nursing home, I personally would not even think of it as a nursing home, but rather an apartment or apartment suite, or even little condo. And so, at any rate then, isn't it interesting then too, that there are several books talking of the tranquilizing effect of certain drugs today. For there is the book Comfortably Numb, talking about how Iowa has had in the past, I don't know now, the most use per capita of antidepressants, as they are called. Now, of course, Iowa has a lot of farmland. It could be quite boring at times, and thus less distracting than average as per how to live life, and that in turn causing a lot of anxiety. How interesting then that antidepressants are routinely or often used for post-traumatic stress disorder, i.e. a form of anxiety also. Yet another book, This Is Your Country, High on Drugs, talks of massive drug use in America. But it never perhaps says that there could be massive drug use called medications also at an all-time high, noting that America is in a three-way tie, or was, as mentioned in the book Comfortably Numb, I believe, for use of antidepressants. And it was also stated somewhere, perhaps in this book, that 1/3 of American women are utilizing antidepressants. It does not say that antidepressants were used to dull emotional pain caused by many a marriage that is not so pleasant, or a combination of working plus raising children, working out of the home, that is. On other issues also, like moving too often, or other issues like poor schools for the children, or neighborhoods that are very challenging, unsafe, so to speak. And so the antidepressant for many a woman, arguably dulling their minds because they're not very happy campers, particularly when it comes to their children and their children's welfare, or how things are getting along in their marriage between the two of them, the spouse, that is, and themselves. One last book, then, to consider, perhaps the title of it at least, is Drugging the Poor. That's actually the title. And one book I'm trying to remember the title of, Criminalizing the Poor. Well, perhaps we ought to consider, too, not just the phrase criminalizing the poor, but terming the poor far more, quote, mentally ill than the rest of society here. And so, isn't it interesting, thus, that we did call Thorazine a tranquilizer and then relabeled it? And I have never heard antidepressants called tranquilizers. Nor have I heard food called a tranquilizer, although I did hear a psychiatric nurse once call food her drug of choice. She was a little chubby around the midsection, weighing in probably about 400 pounds, at least 300, and she declared food is her drug of choice. Maybe she should have said with clarification it was her tranquilizer of choice. For others turn particularly to sleep oftentimes. So these are all interesting issues, I believe. All too often, mankind tends to lose sight of the forest for the trees. I have a book, for instance, also called Data Smog. There being so much data that we can't keep track of what's very important, what's not, noting that Henry David Thoreau, who went to Walden, went to this cabin on a pond for about 2 years, if I remember correctly, to simplify. Perhaps if we simplified the variety, the huge variety now of drugs used that are called medications for emotional suffering, tranquilizers, instead of a whole bunch of different classes of drugs, we might reframe things a little bit differently, I think. So once again, to recap, why do we call something a police state? For 3 weeks ago, I saw a sign in a small town in my state saying, "Police lives matter." Maybe the police are a little bit tired of having certain things blamed only on them, when in fact, many a problem may be caused by escapism, and maybe overuse of tranquilizers called medications, perhaps, is a form of escapism, just like it is said isolation can be escapism, or going to bed too early routinely for those who are, quote, depressed, as an escape valve. Of course, we all know that heroin, for instance, or fentanyl or meth, some argue marijuana, is something used for escapism, and that society has put a cap on just how far it is going to permit the average citizen to use this. For after a while, we might have way too many people, quote, zoned out, or what you might call then with medical use for psychiatric drugs, medheads. The term also pillheads being used. I have a book, and the title of it includes the word pillhead. So if we have pillheads and we have people using marijuana, there being a term for this, why not have a word medhead also? Once again, sleep being considered a way of escape, isolation, and there even being, of course, violence or aggression used to get out your frustrations. Maybe that's a form of drug also. All thoughts to consider here, I believe. I think it pays not to get too wrapped around the axle about terminology, what is called a tranquilizer, what is called a medication. I believe strongly no one should go cold turkey off of any drug. In rehab, you would not go cold turkey off of a heroin addiction even. But long-term use, I believe, is a questionable item, and especially if one has been assigned, so to speak, tranquilizers numbing tranquilizers, adding up to pill usage of, say, 7, 8, 10 drugs. And if there are car accidents involved also, and poor performance at work, and things slipping over the years such that by the time one reaches 60, one is facing a whole set of issues and is soon to be shipped off to some, quote, Shangri-La, if we will, where one will find oneself not that happy or unhappy a camper, because there will be more ways of tolerating it since 1951. So, thoughts to consider, I believe. I hope we don't get too wrapped around the axle how to define coping with so many types of ways that we lose track of the depressed functions that drugs can have upon our brain, both in terms of thinking on any ideas or anger and fear. Noting, by the way, as a last comment, the cognitive behavioral therapists say that our moods, so to speak, and I would say moods ought to be updated to say anger and fear, and the fluctuations of them being called mood problems. But at any rate, if you numb your mind through drugs or sleep or meditation such that you block all thoughts out, push them away, well then, of course, if thoughts cause problems called emotional suffering, tranquilizing would slow or stop the pain, including, quote, depression, because you stop the thinking and the painful results, as per cognitive therapy talking this, would also stop. That's why, of course, we don't suffer much depression, so to speak, or emotional suffering of any sort while sleeping, unless having a, quote, nightmare. And if, quote, dead, we suffer also not a whit, because we are tranquilized completely. Some thoughts, once again, to consider. From someone who is not a medical doctor, does not recommend that a person go off medications they're prescribed, but does ask or suggest that we think about how we define things, for words are very important. I believe this very strongly, that words matter a lot, including what you call terminology about what we ingest. Even food, then. Food can be considered by some, even practitioners in the medical field, a drug of choice.